In the coming days, our department will announce that we are making changes and improvements to how we process asylum claims. We continue to rebuild our immigration system to ensure fairness and promote equity. We are expanding the virtual platform that we used so successfully to assist the migrants in Camp Matamoros, which was intolerable conditions. We are using that virtual platform where migrants could register using their phones, and we were working with and are continuing to work with and will increasingly work with community-based organizations in Mexico, international relief organizations like the UN High Commissioner for Refugees, like UNICEF, like the International Organization for Migration, to bring in individuals in a safe, orderly, and humane way when, in fact, they make a claim for relief under United States law that the law recognizes. We are also, of course, addressing the detention conditions here in the United States. And, of course, I think you're all aware of the measures we've taken in that regard, and we will continue to take the measures that the situation warrants. As I mentioned earlier, the COVID-19 pandemic presents a unique and significant challenge. We are seeing an increase in positivity rate among the migrant population. We built an architecture to test and isolate the migrants who make a legal claim for asylum. With respect to unaccompanied children, they are tested and cohorted on intake before we move them as rapidly as possible to the shelter of Health and Human Services. With respect to families, we continue to operate centers where families are tested and isolated as needed. We are working and have established a system with non-governmental organizations in the communities to test and isolate family members as the situation warrants. And as I mentioned earlier, the predominant majority of single adults are expelled rapidly from the Border Patrol. Now, of course, the Delta variant makes the situation more difficult. Our capacity to test, isolate, and quarantine the vulnerable population that makes a legal claim for asylum is stretched. The rate of positivity among the migrants is at or lower than the rates in our local border communities. As has been expressed by the medical professionals, this is a pandemic of the unvaccinated. We are building new capacity to address the situation, and we are doing so as rapidly as possible. The extent of the challenge should not be understated, but nor should our ability to meet it, thanks to our workforce, our expertise, our plans, and our execution of those plans. Our mission is to protect the American public and to administer the laws of our nation. Consistent with that, our efforts will uphold our laws and will uphold our values. That includes the laws of humanitarian relief as well as the laws of enforcement. We will work relentlessly to thwart illegal immigration and to adjudicate asylum claims fairly and efficiently. Both are embedded in the law, and we are committed to upholding both. As we work to meet these long-standing challenges, we do not turn our backs on our values, our principles, our humanity, and our proudest traditions.